We want to do no harm. So how do we create a good case if we're audited, or when we're audited, really, a chart review comes up, we can make our case that the claim should have been paid, that the date of service was medically necessary. We can prove that confidently. If the sociopolitical climate evolves in one certain direction, that we're not incriminating provider, client, and other healthcare providers. While there's, in theory, confidence in the therapy space, what's documented is not nearly as private as it used to be. When I was in grad school, we talked about having two forms of security, like locking a cabinet in a locked room. And it doesn't really matter how many locks are on the cabinet if a large nationally known EHR that shall remain nameless access to that file. And there are certain safeguards in place, like tracking account activity, but the harm can already be done at that point. Being thoughtful about finding that magical balance, which is, as so much in counseling, an art form, not a science, of how much information to include, but not enough to incriminate healthcare provider, whether it's yourself or another healthcare provider on the treatment team, or the client.